My name is Eric Kazarian. I'm an otolaryngologist, head and neck surgeon, also known as an ear, nose, and throat doctor, who specializes in the surgical treatment of snoring and obstructive sleep apnea. In a previous video, I discussed the importance of determining the specific causes of snoring or sleep apnea in an individual patient to guide targeted, effective treatment. On this video, I discussed the procedures that are available to treat what I call the palate region, including a number of procedures that are only performed by those relatively few surgeons who specialize in this area. This video covers a range of palate procedures. This includes 2 procedures to treat snoring, the pillar procedure and palate radiofrequency, and 3 procedures to treat obstructive sleep apnea, Uvulopalatopharyngoplasty, modified expansion sphincter pharyngoplasty, and lateral pharyngoplasty. The palate region is the most common area involved in snoring and obstructive sleep apnea, although certainly not the only area. Because palate treatments differ for snoring and obstructive sleep apnea, we will start with the treatments that can work for snoring. For snoring, less aggressive procedures can work well because there is less blockage of breathing and therefore less of a need to create actual space for breathing. Surgery can involve treatment of the soft palate or the uvula that hangs down to the back of the throat. The most common procedures for snoring involve stiffening the soft palate, including what is known as the pillar procedure and a few technologies that treat the soft palate with a controlled type of cauterization called radiofrequency. The pillar procedure involves placing implants that look like white pillars into the muscle of the soft palate underneath the surface. The diagram shows 3 implants, but I can place up to 5 implants depending on the structure of a patient's soft palate. The pillar procedure works because the implants themselves have some stiffness and because the muscle of the soft palate grows into spaces within the implants themselves, making everything more stable and less floppy. Palate radiofrequency involves creating damage in the soft palate muscle with controlled cauterization. This heals and converts some of the muscle of the soft palate to scar tissue. Because the sound of snoring typically comes from vibration of the soft palate and uvula, the idea behind soft palate stiffening procedures is that by stiffening the muscle, the soft palate is less floppy and cannot vibrate as easily to create that sound. There may also be some improvements in breathing during sleep with stiffening of the soft palate. I have drawings and much more detailed discussions of these procedures on my website and blog if you are interested. Palate stiffening procedures can be combined with other procedures, and if you choose patients carefully and perform the procedures only in patients who are good candidates, they can substantially reduce or eliminate snoring. You may have seen advertisements coming from surgeons or other websites promoting these stiffening procedures, the pillar procedure in particular, as effective treatment for most patients with sleep apnea. Unfortunately, these advertisements are just not true. I'm pretty reluctant to criticize colleagues, but these types of claims reflect a lack of understanding of snoring and sleep apnea and a misread of the research that has been performed on the pillar procedure. The pillar procedure is a great option for many patients who snore and some carefully selected patients with sleep apnea. I was one of the first people in the country to perform the pillar procedure and have been paid as a consultant by the company that manufactured the implants. So not only do I know well the research, but also am trusted by companies to evaluate how well it works and advise them on other products. Some surgeons advertise themselves as experts just because they have done many pillar procedures, but there's a lot of misinformation out there, sometimes coming from surgeons who focus more on cosmetic surgery who just added this to their practice. I encourage you to be careful about what you hear in marketing materials and do not believe just anything you see or hear. With the pillar procedure, like all procedures, the outcomes can vary quite a bit from one patient to another, so it is critical for surgeons to evaluate patients and do everything possible to select the right procedure for the right patient. When we are working with obstructive sleep apnea, most patients require more involved procedures to treat the palate region. The most common surgical procedure performed to treat sleep apnea in this country is called Uvulopalatopharyngoplasty, also known as UPPP or UP3. This procedure was first used over 30 years ago for sleep apnea, and even today, this is what most surgeons have learned to do for sleep apnea. It involves tonsillectomy for those patients who have not had them removed previously, followed by removal of the uvula that hangs down to the back of your throat and a portion of the soft palate. In the last few years, some alternative procedures have been developed to treat the soft palate. Relatively few surgeons around the world perform these procedures because they are newer and more difficult, especially if you do not perform them often. In my practice, I use these alternative procedures in the majority of my patients who have palate surgery for two reasons. First, they seem to have lower risks because they involve more repositioning instead of removal of tissue. Second, they have both shown better results than UPPP in what are called randomized trials, taking patients and randomly performing one procedure or the other on them. I discuss these procedures more on my website, but here is a basic summary. One of these procedures is expansion sphincter pharyngoplasty, and the current technique I use is a combination of the work of surgeons from the US, Singapore, and Italy that I know well. This procedure pulls the soft palate forward by repositioning a muscle called the palatopharyngeus that normally sits behind the tonsil. By sewing that muscle into a new position, effectively towards you in the picture, it anchors the soft palate forward and opens up space for breathing behind the soft palate. It is usually not necessary to remove the uvula. Another procedure, called lateral pharyngoplasty, has been developed by a Brazilian surgeon, Michel Kahali, whom I have gotten to know over the past several years when I have gone down to Brazil to give lectures on sleep surgery. I use this procedure for patients with thicker tissues of the palate and the sides of the throat. Lateral pharyngoplasty involves performing tonsillectomy, carefully dividing certain muscles on the sides of the throat, and sewing things together in a specific way to tighten them up. This procedure has gone through multiple changes over the years as Michel has changed the technique to improve results. The most current version is not actually published anywhere, so I feel fortunate to have the chance to discuss these with him as we have shared our experiences in sleep surgery. Sleep apnea surgery is controversial. Because most surgeons only know how to perform the UPPP procedure, which by itself does not work well for many patients, many people, including many physicians, think surgery for sleep apnea does not work. With dedicating myself to this field, fortunately, we can do much better than that with state-of-the-art sleep surgery. We can do better by being able to perform these newer, alternative palate procedures to go beyond UPPP in treating the palate region. We are also able to perform procedures to treat blockage in the tongue region, addressing a common and completely different area that is important in sleep apnea. Finally, you have to understand how to select from among the available surgical options, and procedure selection has been a major focus of my entire career. Amidst this criticism, it is important to remember that surgery for sleep apnea has shown important, real benefits. High-quality research shows that patients with significant sleep apnea who have undergone palate surgery, even just UPPP, will be less sleepy and have lower risks of problems like high blood pressure, heart attack, or even early death than those who are left untreated. For someone with sleep apnea who is not able to tolerate positive airway pressure, it is important to consider other options, including surgery. Palate surgery, especially with the newer alternative techniques, can be an important part of enabling people to feel better and improve their health. With that discussion of palate procedures, I hope you continue to the last video where I discuss procedures available to treat what I call the tongue region.